Obesity is a condition of being overweight.
People with obesity may or may not think it is a problem for adults and children.
Many people who are obese eat unhealthy foods. An example of unhealthy foods are burgers and fries.
Some school lunches have unhealthy foods, but some schools are trying to change their school lunches to be healthier.
Does the school dictate what is served for lunch, or is it the federal government?
The actual decisions on what is served for lunch absolutely happen at the local level in terms of the actual foods. What the USDA says is how much nutrition needs to be in that lunch. So what types of foods need to be there and the types of nutrients that need to be provided. But beyond that, in terms of exactly what's on the menu, that's absolutely a local decision.
And does the federal government say, okay, we're going to reimburse for free lunches and reduced price lunches only to a certain amount? After that, you have to pay for it on your own to the schools.
No, so it has to do with children's families' income and their qualifying, and however many children qualify for free or reduced lunch, that's how many the school will get reimbursed for.
Diabetes is an effect of obesity, and it should have more attention. It's more than 39% of adults have been diagnosed with obesity.
Continued investment in this program will bring hope for a cure and a better life to the 26 million Americans living with diabetes. The Special Diabetes Program also funds treatment, education, and prevention programs for American Indian and Alaska Native families who are disproportionately affected by diabetes. We must continue our commitment to fighting this deadly disease. Without a timely, multi-year renewal, work that could save hundreds of thousands of lives is put at risk. I urge my colleagues to support legislation to renew the Special Diabetes Program.
Obesity might not be a problem for the following reasons.
According to debate.org, obesity shouldn't be considered a disease because a proper diet and exercise can easily cure it.
Obesity funding is not a big problem to bring to the public's eye, so why should people pay money for something they may not have?
The Democratic Party believes that some healthcare prices are too high for some families or citizens, and there should be affordable healthcare so everyone can afford it.
The Republican Party believes that healthcare should be easier for people who have health problems like obesity, and that it should be better for people who cannot afford it. Is obesity caused by how much you eat from your perspective?
No, it's a combination of different things. So, a combination of portion of food that people consume on a daily basis. It's also the kind of food that they eat. It's also the lack of inactivity. So they consume a lot of calories, but they don't burn as many calories as they consume. It is also the amount of empty calories that people are consuming when it comes to sugar-sweetened beverages. So anything that has to do with juice, soda, Starbucks coffee, and things like that. It's really what is causing it. So it's not just the food it's the quality of the food you eat, it's the quantity of the food.
What are your thoughts on obesity?
Well, it's an epidemic. It's a current epidemic. It is currently the problem, especially with our kids. Research is showing that our current kids right now, like yourself, are going to live 10 years less than me. So, for example, if I live until 80, my kids are only going to live until they're 70. So it is shortening their lifespan because of the lack of healthy foods available, and also it's going to kill future generations. So it's a huge problem.
Obesity may or may not be a problem with certain people, but it is a problem that can be discussed with